Hello and welcome. Today, we're diving into a condition that affects the heart's vital machinery, mitral stenosis. We'll explore what it is, why it happens, and how it's managed, providing you with a comprehensive understanding of this important heart condition. Mitral stenosis primarily stems from one culprit, rheumatic fever. This inflammatory condition, a complication of untreated strep throat or scarlet fever, can wreak havoc on the heart valves. Over time, the inflammation scars the mitral valve, causing its leaflets to thicken and fuse together. Rarer causes include congenital heart defects, calcium buildup on the valve, or even certain tumors. Now, let's understand the how. The mitral valve, situated between the left atrium and left ventricle, normally opens wide to allow blood to flow freely. In mitral stenosis, the narrowed valve restricts blood flow from the left atrium to the left ventricle. This leads to a backup of blood in the left atrium, causing it to enlarge. The increased pressure then transmits back into the pulmonary veins and lungs, leading to pulmonary congestion and, eventually, pulmonary hypertension. The right side of the heart then has to work harder, which can lead to right heart failure. Mitral stenosis, largely due to the prevalence of rheumatic fever, is more common in developing countries. However, with better treatment of strep infections, its incidence has significantly declined in developed nations. Women are more likely to develop mitral stenosis than men, and symptoms typically appear several years after the initial rheumatic fever infection, often in adulthood. The symptoms of mitral stenosis vary depending on the severity of the narrowing. Common symptoms include shortness of breath, especially with exertion or when lying flat, fatigue, and swelling in the ankles and feet. Patients may also experience palpitations, chest pain, and a cough, sometimes producing blood. In severe cases, complications like atrial fibrillation or blood clots can lead to stroke. Diagnosing mitral stenosis involves a thorough physical exam, where a characteristic heart murmur can often be heard with a stethoscope. An echocardiogram, using sound waves to create an image of the heart, is the primary diagnostic tool. It helps visualize the narrowed valve, assess its severity, and evaluate the function of the heart chambers. Additional tests like an electrocardiogram, ECG, and chest X-ray may also be used to assess the heart's rhythm and size, and to look for lung congestion. While not formally classified into distinct types, mitral stenosis is often graded based on the severity of valve narrowing and the resulting pressure gradient across the valve. Mild stenosis may cause minimal symptoms, while severe stenosis significantly restricts blood flow and leads to more pronounced symptoms and complications. Treatment aims to relieve symptoms and prevent complications. Medical management includes medications like diuretics to reduce fluid buildup, beta blockers or calcium channel blockers to control heart rate, and anticoagulants to prevent blood clots, especially in patients with atrial fibrillation. For more severe cases, procedures like balloon valvuloplasty can open the narrowed valve. This involves inserting a catheter with a balloon into the valve and inflating it to widen the opening. In some cases, surgical valve repair or replacement may be necessary. The best prevention for mitral stenosis lies in preventing rheumatic fever. Prompt and complete treatment of strep throat infections with antibiotics is crucial. Educating communities about the importance of seeking medical care for sore throats and completing the full course of antibiotics is essential in reducing the incidence of rheumatic fever and, consequently, mitral stenosis. The prognosis for mitral stenosis depends on the severity of the condition and how well it's managed. With appropriate treatment, many patients can lead relatively normal lives. However, without treatment, severe mitral stenosis can lead to serious complications like heart failure, pulmonary hypertension, and stroke. Recent research is focusing on developing less invasive methods for valve repair and replacement, as well as exploring strategies to prevent the initial rheumatic fever attack. Ongoing studies are also investigating the long-term outcomes of different treatment approaches to further improve patient care and quality of life. Thank you for joining us on this informative journey into the world of mitral stenosis.